If you're noticing worsening PMS, anxiety, and sleep-related issues in early perimenopause, but you're not quite ready to consider hormone replacement therapy, then Vitex might be a great option for you. Today I want to walk you through what Vitex actually does, who it can help in early perimenopause, and who it might not be the right fit for. As a reminder, in early perimenopause, progesterone often declines first, while estrogen is still cycling, sometimes higher than before, sometimes erratically or unpredictably. And this creates a relative progesterone insufficiency, or sometimes referred to as estrogen dominance. And this imbalance is what creates so many of the symptoms in early perimenopause. Vitex can be a helpful tool in this phase. Vitex doesn't replace hormones. Rather, it works upstream and enhances the way the brain and the ovaries communicate. Vitex is also known as chaste treeberry. It doesn't contain any progesterone, and it acts by hormone signaling rather than providing the hormone itself. It enhances the communication between the hypothalamus, the pituitary gland, and the ovaries. And for most women in early perimenopause, that enhanced communication can indirectly support a more robust progesterone production, especially in that luteal phase of the cycle where elevated progesterone is necessary to balance those high estrogen symptoms. Improving hormone balance with Vitex may help with a number of bothersome symptoms in early perimenopause. Things like increased breast tenderness, worsening PMS, anxiety, irritability, and mood swings, terrible sleep the week before your period, even food cravings and fluid retention might be improved with Vitex. I typically think of Vitex for those women in their 40s who are starting to experience those early perimenopausal symptoms, especially those women who still cycle fairly regularly, but things feel terribly imbalanced and off, especially in that week or two prior to their period. In my experience, these are the women who benefit the most from Vitex. And that makes sense because Vitex is a signaling herb. And so it really depends on the ovary's ability to respond to that signal or that enhanced communication. Whereas later in the perimenopausal transition, as the ovary's ability to respond declines, Vitex just won't be as powerful. So for women who are later in the perimenopausal transition, as the estrogen levels are declining, the progesterone's already declining, and the ovaries are less able to respond, Vitex is typically not my first choice, and we might be starting to think about hormone replacement therapy or other options at that point. And it's really important to think about this timeline because if Vitex is used later in that perimenopausal transition, adding Vitex can actually enhance some of the symptoms of perimenopause, making things worse, not better. So the timing really is important, and matching the tool for the appropriate stage is critical. So Vitex and progesterone hormone replacement therapy are often discussed in similar context, but they're quite different. Vitex, as I said, was a signaling herb working upstream to enhance communication, whereas progesterone is actually providing that hormone replacement therapy as the ovary's ability to produce it declines. And that's why it can be such a great bridge for women who are experiencing symptoms that are very disruptive to their life, but they're not quite ready to reach for HRT. So for Vitex to be the most effective, it's taken daily rather than cyclically, and it's important to understand that it's not fast acting. It may take 6 to 12 weeks of daily consistent use before a woman really starts to notice a balancing effect with her hormones. So if Vitex is going to help, it's going to happen gradually, not overnight. Be patient and understand that you're affecting upstream communication pathways rather than direct hormone replacement. The dosing of Vitex varies, and it needs to be individualized for each woman's specific situation, but I often find that dosages for perimenopausal symptom control are in the range of 100 to maybe 500 milligrams daily. Of course, always consult with your personal healthcare practitioner who knows your complete story and can guide you as to the appropriate next steps. So what about lab testing? I have a lot of women who come to me in the perimenopausal transition saying, I want to check my hormones. I want to see what my levels are. And that's great, but it's really important to understand that the levels of hormones, especially in that early perimenopausal transition, are fluctuating so rapidly, daily, weekly, and it's really hard to interpret or understand what's truly happening just based on a single lab draw. So in that early perimenopausal transition, I often rely on a patient's symptoms as much or more than I do on a single lab draw. If a woman's symptoms are clearly cyclic, meaning they occur especially in that week or two right before their period with the PMS, anxiety, sleep issues, mood swings, then those are the women who typically benefit the most from Vitex. So Vitex can be an incredibly useful tool, especially for those women in early perimenopause. It's a great bridge for those women who aren't yet ready to consider HRT, but it's not a one-size-fits-all approach. Understanding when it can help and when it might not be the right fit is really important to understand. So throughout this series, my goal is to help you understand which tool meets which phase so that you can make informed, grounded decisions about your health. Have you tried Vitex? Are you curious about it? I'd love to hear from you in the comments. I'm Dr. Kate. Thanks for being here, and I'll see you in the next video.